Not even know it. A new survey conducted by the American Stroke Association found out that 1 in 3 adults may have had a mini stroke. And joining us now is Dr. Mitchell Elkind. He is a neurologist and chair of the American Stroke Association. Good to see you. Thanks so much for joining us.
Thanks for having me, Casey.
So is it possible to have a stroke and not even know that it happened?
Yeah, it actually is. People can have a very small stroke that doesn't cause any symptoms at all, or they can have what we call a TIA, or a transient ischemic attack, sometimes called a mini stroke or a warning stroke. It's when there's a temporary interruption of blood flow to the brain, but the symptoms go away after several minutes. The problem is that that can be a warning sign for a bigger stroke that could come later.
Okay, so what are some of those symptoms that might be going away that we should take note of and obviously go see a medical professional?
Sure. So the main symptoms that we worry about can be remembered pretty easily with an acronym that we call FAST, F-A-S-T. The F is for face. So if there's face drooping, the A is for arm weakness, the S stands for speech, so speech difficulty, and if any of those are present, then it's T, time to call 911, emergency help immediately.
Absolutely, and of course, get to a medical professional as quick as possible, have an ambulance come and take you. I know time is of the essence for something like this. What is done when someone is brought into the hospital who is exhibiting signs of a stroke?
That is a great question. Fortunately, stroke is very treatable these days, and we have great clot-busting medications that can dissolve a blood clot in the blood vessel. We also have these devices that can go into the blood vessel and pull the clot out. The thing is that those have to be done very, very quickly within just a few hours of the stroke beginning, and that's why it's so important to seek help immediately. In the survey that we did recently, we found that only 3% of people who had symptoms of a TIA sought help immediately. Many people would just take a nap, rest, wait it out, or take medication at home, and that's really not the best way to handle this.
What can people do who are watching to lower the risk of having a stroke?
Sure. So stroke is also very preventable. One of the best things to do is to control blood pressure, to get it checked. If it's elevated, to then have, together with the doctor, treatment perhaps to bring it down. So that would be one of the best things to do. And for people who've had a prior stroke, there are treatments that can reduce the risk of another one. Something as simple as taking an aspirin a day may be appropriate for many patients, but of course you have to talk to the doctor about that.
Sure. When we talk about blood pressure, because we have a couple extra seconds here, what is the blood pressure that we're looking for? What's good, what's bad? If someone's going to go, you know, I know that the Gate gas station down the road for me has one of those blood pressure pumps where you can go and get your blood pressure taken for free. When we see those numbers, what are we looking for? What's not good? What's good?
Well, ideal blood pressure would be less than 120/80, and our targets for blood pressure have come down over the years. So it would be a good idea to talk to the doctor about it. Getting the blood pressure checked at the gym and things like that is a good idea. I probably wouldn't rely too much on the local gas station attendant for blood pressure recommendations, but 120/80 would be a good target. Again, it depends a little bit on one's individual medical conditions. For example, diabetes and things like that may influence the blood pressure targets as well.
Sure. It seems like they just pop up everywhere now. You're seeing a lot of blood pressure cuffs as people are becoming more and more, you know, taking a role and taking care of themselves and making sure that they're in good health. Dr. Elkind, it's so good to see you. Thank you for joining us. We appreciate your expertise and coming and joining us live here on the show.
Thanks for having me.
And we'd like to thank the American Stroke Association for sponsoring this segment. Well, still to come, Chef James is going to join us, and he's going to be talking